Okay, my lovely viewers. So we are in the second stage room. Okay, so your midwife says that she cannot feel the cervix around the cervix around your baby's head anymore, and that she can see your baby coming out. Okay, so so long as you say that you are 10 centimeters dilated, that means that you are ready for the second stage of labor. So what can be done? What do you expect? So your midwife will what lead you to the second stage room. She will check your vital signs again, your temperature, your pulse, your respiration, your blood pressure, then most importantly the heart rate of your baby. Okay, she lines your bed with the Macintosh and the towels and covers you up and cleans you up with Savlon. Okay, then she puts a pad, perineal pad, at your inner region. Okay, then this is the education we give you. Now, when your midwife tells you that it is time for the baby to come, or you even feel that it is time for the baby to come, and you tell your midwife, and your midwife assesses and says that, oh yes, it's true, it's time for the baby to come, what do we do? Okay, what do you need to do? So if you can urinate, we help you to urinate. Okay, if you cannot, also we pass a catheter, a straight catheter, to remove the urine. Then, as I said, we clean you up. Then the education is that when you feel that your abdomen has tightened, that is the contraction. When you feel that your abdomen has tightened and you are in pain, okay, in your lower abdomen, please push. Okay, you push, you close your mouth and you push, you bear down, okay, as if you have constipation and you are visiting the washroom. Do you understand? You push long for a long time. Okay, and if the contractions stop, your abdomen does not become tight anymore, if it becomes loose and you do not feel the pains anymore, please relax and take in deep breaths. You pant. Okay, you take in deep breaths and relax. Then as soon as the pain starts again, you do what? You bear down again. You push with all your might. You don't scream, because sometimes when you scream, the energy or the power will not be exerted down to your the lower abdomen and the powers that should bring the baby out. Okay, so we want the power in the perineal area where you push the baby out, for the baby for the baby's head to come out, for us to help you bring the baby out. So we tell you, when the contractions come, you push. When the contraction ceases, you stop. Because when the contraction ceases and you continue pushing, you are only wasting your energy. Nothing is happening. Do you understand? Nothing is happening. You can push 1,000 times without contractions and the baby will not come. What helps the baby to come is when the contractions are up. I hope I've made myself clear. Okay, so you push with contractions and you rest in between contractions. Okay, you can request for water if your throat is dry. Some also request for malt. Okay, then you continue the journey. You push with the expectation of the baby coming out. Your 9 months journey, the vomiting, the salivation, the discomforts, this is the deciding moment. This is the penalty kick. If you destroy it, this penalty kick, we are all not happy. So with the aim of bringing out our baby. Please, do we understand? So that is what I've told you. And if you have given birth before, within 30 minutes we want you off that delivery bed. If you have not given birth before, within 1 hour we want to get you off that bed. Okay, so that within 30 minutes, for somebody who has given birth before, if the baby keeps long there, results may not be so good. And if you have not given birth before and it's within 1 hour, outside 1 hour, the results may not be good. So that's why you see your midwife forcing that your baby should come within a stipulated time. So when the baby comes out, that is the end of the first stage of labor. Then you request that your baby be put on your what. Before then, we even have to tell you that we clean your chest area for you and put the baby on your chest. So when your baby comes out, your baby will be put on your chest. This will what will start what the bonding process. Okay, you bond with your baby, and you see that the baby finds his way or her way to your breast and starts breastfeeding. Your baby has to be on your breast, on your chest. The cord shouldn't be cut. Okay, within 3 to 5 minutes, the cord should not be cut. This will allow what more blood to flow from you to the baby, so that more antibodies will what go to the more antibodies will go to the baby. If your cord is cut too early, it's not good for the child. So make sure that your cord is not cut early. The midwives are also aware they will not cut your cord early. Okay, so delay cord clamping really helps with the baby. So make sure that your cord, the baby's cord, is not cut early. Within 3 to 5 minutes, it has to wait for the cord to stop pulsating. Then your midwife will cut the cord. Then they will what dress you up. Okay, then they will clean you up. Then starts the third process. The third stage of labor is when the placenta is what removed. And when the placenta is going to be removed, you would have to be what injected. They will give you an injection on your what on your thigh. Okay, then they will empty the bladder, or they will help you to urinate. Then they will take the placenta off. Please, do you get me? For those of us whose private part is very tight, or whose babies' heads are very big, okay, or whose babies are coming with their bottles that the midwife would assist you to do the delivery, the midwife may give you what we call an episiotomy, meaning that your perineum, or your the area between your vulva, or what the layman term your vagina, but the vagina is inside there, your vulva to your anus, that area will be cut, okay, to allow what the baby to pass smoothly. Do you understand? We'll give you an injection, then we cut that area, then we'll let the baby come out. So after the third stage of labor, when the placenta has been taken out, the midwife will now massage your abdomen. We call it massaging of the uterus. They will massage your abdomen. It's very uncomfortable. I wouldn't lie to you. I'm a woman. I've gone through it 3 times. It's not easy, but your midwife has to do it to let the clots of blood that are inside, or any lobe or any foreign material that is inside, come out. When she does that, she pats your vulva area, okay, your private part, to check to see if it had aside the episiotomy, or even if you were not given episiotomy, the place is torn. If the place is torn, then your midwife will do what? Will seek your permission, inject that area, and sew it nicely for you. We are the only profession that has been given the license to sew the woman's private part. And when she does it neatly, perfectly, you will be a virgin again. So please allow us, okay, to do a neat job for you, okay, because if you give birth and the place is torn and we do not suture it, your private parts becomes what laxed, okay, but when it is sewn well for you, your private parts will be intact for whatever you want to use it for. I hope I've made myself clear. Then the fourth stage of, after she has finished sewing that, the fourth stage of labor is when your baby is monitored, and the mother, are also monitored to avoid any unforeseen circumstance. We want to see if there is any danger. We want to take the first measurements of the baby to serve as a basis for further measurements, okay, to know if there are any abnormalities and correct them immediately, so that nothing is takes us by surprise. Catch me in my next video for us to do the concluding part of the stages of labor. Catch you on the flip side. Bye for now.